Joining us now to tell us more on the mental and physical impact of this potential change is Dr. Michael Antle himself, University of Calgary Psychology Professor. Sir, welcome to Forum Daily.
Good morning.
So let's start with this, Doctor. What kind of impact does a 1-hour time change have on the human body?
So our body, it follows two main clocks. One is, of course, the sun that our biological clock follows. And then the other one is our work clock, the one that our boss uses or our teachers use to tell us when to be at work or school. And you want to make sure there's not much of a conflict between those. And if they're in line, like they are on a more natural standard time, it's healthier for the body. But when there's a conflict, when they're out of sync, like when you make a time change, that's when problems start to creep up.
Now, some would consider this switch to daylight time relatively easy, but you say Alberta would do better sticking with this standard time that you mentioned. So this is rather than daylight time. So tell us a little bit more about the differences between standard time and daylight time and why we should switch to standard time instead.
Right. So every sleep and circadian organization in the world has been endorsing the move to standard time because it matches our circadian clock to our social clock, our work schedule. But in Alberta in particular, actually, Alberta follows a time that's not quite right for us. So we even have daylight time when we're on standard time. And the move to a permanent daylight time would actually be more like double daylight time. So it would actually accentuate the difference between our biological clock. So it doesn't seem like very much, just an hour, but because of the time we follow is kind of offset anyways, it would be really bad and hard for Albertans.
Now, meanwhile, the referendum question yesterday specifically mentions adopting a year-round daylight saving time. So what would that look like for Albertans throughout the seasons?
Right. So we have glorious long days in Alberta in the summer. They're really late sunsets. But we have a really strong photo period that changes quite a bit over the year. So in the winter, we have really short days. And if we're on daylight time, that means the sun doesn't rise in Calgary in December until after 9:30. It's close to 10 a.m. for Edmonton. Places to the west, like Grand Prairie, might not see the sun until almost 10:30 in the morning. And that's where the challenge comes in, trying to move to a daylight time.
And what kind of health problems could this switch to just daylight time in particular lead to, Doctor?
So they've looked at people who live at different sides of a time zone. So they all follow the same clock, but are, sorry, just just sorry, they're on different sides of the time zone. People on the west edge actually have a later sunset, and they have less sleep. So going along with the less sleep, you actually have increased rates of diabetes and cancer in those cases.
Now, that's really interesting, Doctor. So I really want to go back to Professor Mathewson's comment. How is sunlight connected to the overall health of people?
So sunlight is what our biological clock uses to set its phase. And that's where the problem comes in when we're following daylight time, is we're actually offset. So, and it's the morning light that's really critical. Our clocks run a little slow, and morning light helps keep them on time. And it also helps with our mood. So in Canada, because we have these short winter days, you had increases in seasonal affective disorder. And it's the morning light that seems to be most beneficial for helping keep those people happy.
And we know that you're advocating for a standard time across Canada. So what would that look like, and how would that benefit all Canadians?
Well, you get rid of the spring forward time change. And we know that spring forward time change is bad. And I think that was the goal of this referendum, was actually to get rid of that. And I've been arguing for about 15 years now to get rid of it. But unfortunately, we were presented with an alternative that was worse. Standard time helps keep our clocks more aligned with our circadian clocks. So that's why that would be better for us.
All right, Doctor, just about 45 seconds here, but here's a thought. Can the circadian rhythms of Albertans eventually adjust to just daylight time in particular?
Well, they do okay with the changing photo periods. And so we do okay as the days get really long when there's a surplus of light in the summertime. But the hard thing is in the winter, there's not a lot of light. It's a very short day, and your body, your circadian clock craves that. And it's going to follow it. There's no way to get around that. So that part you can't really adjust to. You're not going to get used to it.
All right, Dr. Antle, some really interesting information there. Thank you again for joining us today on Forum Daily.
Thank you.